allergies are on the rise, especially food-related allergies in infants and children. Today, Dr. Jonathan Malka, Director of Allergy and Immunology at the Pediatric Associates, joins us today to talk about the rise of infant allergies and share how parents can take allergic action today to promote a healthy and happy tomorrow. All right, doctor, so what does every parent need to know about food allergies for infants and young kids?
Thanks for having me. So we have to know that milk allergy is an immune reaction to a protein known as casein, which is present in the formulas. It is a common reaction. It's one of the five most common food allergies we have nowadays. We have to know the symptoms that are associated with the exposure to cow's milk allergy. They may present with immediate hives, vomiting, difficulty breathing, shortness of breath, or anaphylaxis, or more GI-related symptoms such as vomiting, bloody stools, mucus in the stool, or failure to thrive. It is important to understand that incidence of milk allergy in adults in general has doubled in the last decade, now currently affecting about 7 out of 10 children with food allergies. What
is the allergic march, and how does it impact a baby's future health?
So it's important to understand the allergic march because you may alter progression of disease. So what it is, the allergic march is the onset of food allergies or eczema early in life with the risk factor of parents having a food allergy themselves or other allergic conditions. You are likely to develop other allergic manifestations later in life. For example, children with eczema and food allergy, 4 out of 10 children will likely have asthma symptoms by 5 years of age. 2/3 of them will have other food allergies, such as egg and peanut. 1/3 of the patients may have eczema, and a significant amount will have rhinitis, which is nasal or ocular symptoms much later in life. So it's important to understand the symptoms of food allergies, understand the risk factors, and understand the allergic march to hopefully minimize the progression of disease by doing the right intervention early in life.
How can parents and doctors manage cow's milk allergy in infants and reduce the risk of other allergies as well?
So it's a great question. So it's important to understand the symptoms, as we just discussed, the risk factors, and understand there are formulas available nowadays to help you minimize symptoms and alter progression of disease. The use of formulas such as the extensively hydrolyzed formulas with probiotics such as Lactobacillus rhamnosus can actually hopefully minimize the incidence of food allergy reactions with the use of this formula, in addition to alter progression of disease and minimize the risk of asthma, eczema, rhinitis, and or ocular symptoms, in addition to eczema later in life. So it's important to discuss with the pediatrician if the symptoms are present, if you have risk factors for food allergies. Therefore, you can choose the right formula with a combination of Lactobacillus, which is a probiotic in the extensively hydrolyzed formula, to minimize the risk factors associated with the allergic march.
Okay, where do we learn more?
So that's a great question. That will be takeallergicaction.com. That is takeallergicaction.com, in addition to discussing with your primary care provider. And this is a great website for the parents to utilize.
Very good. We'll check it out. Important information today. Thank you.
Thank you.
Coming up.